The devastating earthquake in Haiti happened on January 12th, just a few weeks ago. And within hours, 700 Salvation Army officers and permanent staff stationed in Haiti started the response to the needs of the Haitian people. The Salvation Army has been sending doctors, volunteers, and Salvation Army officers from around the world to assist. I have two of those doctors right here that have just returned from Haiti a few days ago. Lieutenant Colonel Dr. Herb Rader and Captain Dr. Cindy Lou Drummond. Both are Salvation Army officers from the USA Eastern Territory. Just some general questions about your experience. First of all, how long were you in Haiti? And what were your assignments while you were there?
Well, I went down on the 18th. I think Cindy Lou and I went down pretty close to each other. And it seems like that we were there for at least 2 months, but it was a highly compressed emotional experience. And we actually were there for 14 days. Yeah. Most of the tours are for that period. The Army has a highly developed scheme of rolling out this relief effort and slots us into specific periods there in order to meet the needs of a particular period. Yeah, I would emphasize that there are many people who want to do something for Haiti and look for an opportunity to express their skills there, but find it difficult to go on their own. But the Salvation Army offers a structure and an experienced organization and the logistical support that enables people who are not Salvationists to participate with us and to perform very important roles there. And we had the benefit of working with some wonderful doctors, highly skilled people from universities around the country who were willing to participate with us in our team effort because we had the structure and the clinic and the space and the logistical support and the transport and the communications and other things already in place that enabled them to just use their clinical skills in practical ways. So it was very good to work with them.
Now, Dr. Drummond, you were the team leader?
Yes.
How many on the team, and what specific assignments did you two of you have?
We had a new team come in on the Sunday, and we put them to work right away. We had 14 people on that team, and we actually had to move the clinic from one location to another because of structural problems. And from that point, we had our assignments. Those that were in primary care were seeing the patients with medical problems, pediatrics, and then those with surgical skills, such as Dr. Rader, they were seeing the surgical patients that needed to have minor surgeries, revisions of wounds and fractures and things like that. And we had a full-scale, in Haitian terms, pharmacy, I'm sure, but we had plenty of things that would keep us. We could treat patients practically and then follow up with the proper medications.
Dr. Rader, I understand you're a surgeon, and you did many surgeries while you were there for the last couple of weeks. How many did you do, and what type of surgeries?
We did what had to be done, and we were taking care of patients as they came with their particular needs. We didn't schedule patients for elective surgery tomorrow. We were taking care of patients as they came. And in the early days, with very little equipment, very few supplies, and a very inadequate space to do this, and a distressing lack of light, we were doing what we could to take care of the kinds of injuries that we saw. If you want to understand what they look like, you could look at the pictures, but it grosses people out. So I'll just tell you to imagine what happens when a wall or a ceiling or a house falls on you. Many people did not survive this, a tragic number of deaths. Many people remain under the rubble, but many did escape. Many were pulled out. Sometimes it was necessary to amputate an arm or a leg in order to extract a person from the rubble. Then we were charged with improving the appearance of the stumps or managing infection or preventing infection in these stumps. Sometimes a rock would fall on a limb and crush it so that it was necessary to save that limb, if possible, by debriding and revising the wound and protecting it from infection. And by the grace of God, astonishingly, we did not experience a progressive, advancing, ascending infection. And somehow the wounds did improve over time. They required daily or every other day redressings. So a lot of the surgery was just managing wounds. It was wound care. And the Lord helping us, we were able to see many of those to significant improvement. Over time, a lot of rehabilitation and occupational therapy and physical therapy and prosthetics and other things are going to be necessary in order to get these people right back to work. But we're talking about initial care here. Over time, the nature of the wounds changed, and we were moving from an acute surgical care center to more of a long-term medical type of clinic.
You see that there's going to be a long-term service that the Salvation Army is going to be doing. There's a lot of things going on. What do you see as the biggest needs of the Haitian people now, and how is the Salvation Army helping?
Certainly housing. We had right on our compound, there's a soccer field that abuts the Salvation Army property, and that has been designated the Salvation Army's window in the whole scheme of Port-au-Prince. And there are 15,000 people living in this small area. No toilet facilities. We have to bring in water. So that's going to be a major effort of the Salvation Army to provide for those people. Medically speaking, we're talking about disease in close living quarters. So immunization programs and things that will help with the living there was going to be vital. The biggest thing that day to day that we saw is that people are hungry. There initially wasn't enough food. By the time we left, stores were opening, but money is a very precious commodity, and a lot of people didn't have money. But there are people that are still literally starving because they aren't getting access to food. Now in our compound, we're able to take care of that. The Salvation Army is providing meals in boxes for families of 5 for 5 days, and that has been a wonderful help. But there are major issues that are going to have to be addressed in those areas: shelter, food, and medical.